All right. Hello, everyone. Welcome to Reflection, another episode. Today, I have a very dear guest, Dr. Russel Kennedy, and we're going to talk about anxiety. Anxiety is one of the most common experiences that my clients bring to me, and Dr. Russ has a lot of information, a lot of insight, a lot of wisdom, and I have been working with him personally through some of my healing journey. Years ago. So Dr. Russel Kennedy is known as Anxiety MD, is a physician, neuroscientist, and author of the award-winning book, Anxiety RX. Dr. Kennedy combines neuroscience, somatic practices, unconventional methods to help people heal anxiety at its source. His unique approach integrates the medical expertise with deep emotional insights, offering practical tools for lasting transformation. Dr. Russel Kennedy, welcome.
Nice to see you again, Sadaf.
Thank you. Thank you for giving me your time to be
here. Of course.
So I remember from the very, very old days that I wasn't a therapist at that point yet. Mm-hmm. You keep telling me in the calls and in the interactions we have, heal it to feel it. Where does that come from?
It's actually feel it to heal it. So it's, you have to, but it's both ways actually. So it's really about finding that emotional dysregulation is something that's more rooted in your body than your mind. Your mind's more of a confirmation bias. So whatever your body feels, your mind will create. Your mind is a meaning-making, make sense machine. So if your body feels anxious, your brain is going to give you anxious thoughts. If your body feels content and calm, your thoughts are probably going to be content and calm. And I think what we do in this society is we ascribe a lot of how we feel to how we think. And I would say it's kind of the opposite. We think how we feel. So you've got to feel to be able to process a lot of the stuff that happens to you when you're younger that wasn't processed back then. So you've got to be able to feel it, go back to it, feel it, get in touch with that younger version of you that still feels the same way, and be able to connect with them and metabolize that old pain that should have been metabolized at the time the trauma was occurring.
Mm-hmm, mm-hmm. Yes. And then you move on, because I remember in one of the calls we had together, and I don't know how you knew this, but I was working through some childhood traumas for myself. And you told me, go look in the mirror, look at yourself, and say, I love you. Mm. And really mean it.
Sure.
So how did you know that this is what I had to do?
Well, this is what like 99% of us have to do. So I'm not particularly gifted in that particular matter, but it's just seeing what kind of level of resistance do you have to telling yourself that you love yourself? Yes. Because it seems very disingenuous when you first do it. If you have a lot of negative self-talk, what I call jabs, self-judgment, abandonment, blame, and shame, you have a lot of that. When you say, I love you, or I care for you, or you're a special person, there's a lot of resistance there. And you can tell a lot about how you allow your emotion based on how you resist when you say positive things to yourself. So if you say positive things to yourself and you allow it in, that's a good sign. If you say positive things to yourself and it feels disingenuous or phony or uncomfortable, it probably is a sign that you're not really allowing a lot of good things to happen to you without putting a lot of negative overlay on top of them.
Mm-hmm, mm-hmm. Yes, I know you talk about jabs, and I still to this day I use it, and I read that to my clients. I like one of my teachers, Dr. Russel Kennedy, tells stop jabbing yourself, and I exactly use the acronyms that you use. So what are the sources of when do we learn in our life to start jabbing yourselves? How does that relate to childhood trauma?
Well, I think it comes down to sensitivity.
Mm-hmm.
You know, sensitivity more and more we're starting seeing is there may be some sort of genetic component. Like some kids are just born sensitive. If you ask a mom, which of your kids is the most sensitive, she will tell you immediately. There won't be, oh, it could be this or it could be that. She will know immediately which of her kids is the most sensitive. So we're born with this level of sensitivity. Now, if you're sensitive and you grow up in an attached, attuned environment, you're going to do fine. But if you're sensitive and there's trauma, or, not even big T trauma, like even little t stuff, but even relatively small traumas can be big if they're not repaired. If you don't feel safe or comfortable that your parents or caregivers are going to be able to repair being bullied at school, or having perhaps the parent is the source of your pain. Perhaps you have an alcoholic parent who's abusive, or a parent who is an alcoholic and is also abusive. This kind of stuff gets into us, and especially as sensitive children, we wind up going very quickly to coping strategies. One of them is people pleasing. Getting really good at reading other people, specifically your parents, and then neglecting yourself. And Gabor Mate talks about that, like when you release your authentic self for the sake of attachment. You're not being who you are for risk that the relationship might be impaired in some way. So you be what you think the other person needs. And when you start doing that, you start creating a tremendous amount of alarm in your system. And as I was saying before, when there's a lot of alarm in your system, you will look for what's negative in your world. And kids tend to blame themselves for the trauma that happens in their families. So when there's trauma and it's not repaired in the family, the child automatically starts believing it's them. And then when you believe it's you, then you start developing reasons why. Well, if I was just cleaner, if my room was cleaner, if I came home on time, if I didn't do this, if I didn't do that, if I could only do something more, better, or different, this wouldn't be happening. And this is the start of this inner critic, this sort of internal monologue, this negativity. Now, there's a part of our brain called the posterior cingulate cortex. It's also involved in what's called the default mode network of the brain. And the default mode network of the brain is what your brain does when you're not actively doing something. So your brain defaults into this particular mode of behavior or being. And this posterior cingulate cortex is part of the default mode. And we think that the posterior cingulate cortex may be involved in self-referential thought, these jabs. So if we default into this mode of our brain, and in that mode already, we're already judging ourselves. We're already full of jabs in that mode. Our life is going to be pretty uncomfortable, because when we're not doing something specific, we will default back into this groove of judgment, abandonment, blame, and shame of ourselves, which of course creates more alarm. And you get into this vicious cycle of more alarm, more negativity, more negative thoughts, more alarm. And it just keeps going and going and going. It snowballs on us.
Yeah. And that's what you call the alarm anxiety cycle.
Absolutely. Absolutely. Right. Yep.
Right. I really like the terminology that you use for anxiety, that anxiety is not generated in the mind and it's the body's alarm. Can you talk about more of this alarm? Like how does one's brain function or one's body function when this alarm is on?
Yeah, well, you go into a very emotional part of your brain. You lose the rational part of your brain and you go into a very emotional state. And as we know, our emotional brain isn't very adept at seeing solutions. It's more looking for more problems. So when we get upset, when we start getting into survival physiology, cortisol, epinephrine, norepinephrine in the brain, we start looking for negative things. We start looking for fearful things in our environment to make sense of how we feel. And we'll always find them. Like Brene Brown talks about, don't walk through the world looking for reasons you don't belong, because you'll always find them. And the other thing I love is David Goggins, his comment when he says the mind has a tactical advantage over you, because it always knows your worst fears and will always play up those worst fears, which of course will, create this aggravation of alarm in your body. And here's what I think happens when you're young, before the age of 12 or so. And most of your brain development, 80% of your brain development occurs before the age of 5, by the way. So as your brain develops, if you're in this sort of traumatic loop, traumatic environment, your brain is going to develop this sort of protective look at the world. So you're going to look at the world as a victim. You're going to look at the world as some place that's not safe. So you will automatically find reasons for why the world isn't safe. And we call those worries. So those worries keep perpetuating themselves and they make the alarm worse. So when we're younger and we experience a pain that's too much for us to bear, my acronym is ALARM. So abuse, loss, abandonment, rejection, which can be bullying, M is for mature too early, anything that made you mature too early, and the S is for shame. So abuse, loss, abandonment, rejection, maturing too early, and shame are all the things that create this alarm in our body. And it stores our little child body and brain, offloads the trauma into our body because it's too much for our brains to handle. So that trauma stays in our bodies, and it stays there for the rest of our lives unless we go back and find that younger version of ourselves that is alarmed and show them they're seen, heard, loved, and protected. And then when we do that, we can start really accessing the root cause of anxiety, rather than just chase our, rearrange the deck chairs in the Titanic by trying to make us think differently, because anxiety isn't in your mind, it's in your body. Your mind makes sense of what's in your body by giving you anxious thoughts, but the root cause of anxiety is not in your mind. Your mind is just a reflector of this old trauma, this old unrepaired pain, and the jabs that are still kind of held in your body.
Yeah. So what I'm understanding from what you're sharing with us here is that these beliefs that we form about ourselves and around the world, like the world views that we have about the environment, whether something safe or unsafe, like we have in polyvagal theory, how the nervous system's always scanning, right? And then if it's unsafe, then we come up with the strategies to cope with that. And those are the jabs, and then it goes back and gets stored in the body. The emotions and the anxiety lives in your body.
Yeah, and we're seeing much more in science and neuroscience that memories are actually held cellularly. So, you can hold a memory in a cell, and a cell will behave differently based on being exposed to that. If you expose a cell to acetic acid, like, it will respond to that in the future, and it will remember that and respond in a certain way. So memory is held outside of the nervous system. So trauma memories are also held outside of the nervous system. And then I have people that say, well, I don't think the trauma is held in the body. And I said, okay, well, do you think that we hold trauma at all? Like, if you're, physically, emotionally, sexually abused as a child, do you think you hold the trauma? And they say, yes. And then I say, okay, can you separate the mind from the body? And they go, well, no. Well, if you can't separate the mind from the body and trauma is held, it's got to be held in both. So trauma is held in the mind and the body. So that often kind of makes them think a little deeper.
Yeah. Well, that's a good challenge because, so then would you say that a chronic anxiety or unhealed trauma can lead into like DNA changes or like chronic illnesses or autoimmune disease in any way?
Yeah, because we can form into this protective mode. The DNA can change to become more of a protective being than a growth-based being. So if you have trauma when you're younger, it's not resolved. You look at the world in this sort of victim stance, this sort of, the world isn't safe kind of stance. Your DNA, your proteins will reflect this sort of world isn't safe kind of way of being, way of living, as opposed to someone who was raised in a loving, caring environment who, say, maybe wasn't that sensitive. Then they look at the world in kind of a growth-based mindset where they're not afraid. And this is one of the things I said on Rangan Chatterjee's podcast. If you grow up with love and attention and affection, you learn that life is about connection with other people. If you grow up with trauma that's unresolved, you learn that life is about protection. And your cells, your DNA, your attitude will reflect that.
Yes. How beautiful is that? Is there any time that it's too late to heal your anxiety? Because you mentioned if some experiencing something as a child and there's a caring, nurturing environment, that's good enough to repair it. Or when you grow up as an adult, you realize that then you start reparenting yourself. That's what you need to do. Look in the mirror, look at myself, say, I love you.
Right.
Pretty much that's what I take to be reparenting, doing something that we wish our parents had done.
Right.
So is there any point that it's too late and you can never free yourself from this?
No, you can always improve things, right? Now, there may be a point where, you're always going to be in this sort of state of alarm to some extent. Like people with severe emotional, physical, sexual abuse, that's really hard to eradicate for sure, because the amygdala in your brain never forgets. it never forgets these things. Now, can you create other programs that kind of overwrite the original one? Yeah, sure. That can help. I think that we can always improve. Healing is kind of one of those subjective kind of terms. And if people say to me, have you healed your anxiety? I'd say, yeah, because now I still get alarmed. Like I still feel alarm in my body for sure, but I just don't give it credibility anymore. I don't automatically couple it with negative thinking. I don't automatically have to go into my brain and try and figure out why I feel this alarm. I can sit with the alarm as a version of my younger self, put my hand over it, breathe into it, stay with it without this compulsive need to add thoughts to it. Because as soon as you start worrying and thinking about it, you leave the original source of that pain, which is this, complex trauma that's held in your body. So as you pay attention to it and stay with it and teach yourself that you can stay with it, you learn how to metabolize it. So a little analogy that I draw is cold plunges. I like doing cold plunges. Not really, really cold, like not the ice kind of things, but cold, like stuff that's uncomfortable. And when you first go into it, it's really uncomfortable. When you first go into really cold water, it's really uncomfortable and your brain is screaming at you to get out. And after about 30 to 45 seconds, you're like, okay, I don't like this, but I can handle it. And after about a minute and a half, you're like, okay, I'm adapted to this now. I still don't like the feeling, but I've learned now that I can stay in it longer. And over time, you can start learning how to tolerate colder and colder water. And that's why you see these people dump ice in their as well, because they've acclimatized to the cold water. And now they have to make it even colder to get the same effect. And this is through dopamine, the same effect that they would have got before. But it's learning how to stay with that alarm, which is kind of similar to staying in that cold water. It's uncomfortable. The urge to get out of the water is the same urge to start thinking. You want to escape from this particular stimulus that you're experiencing. But if you learn how to stay with it, and some physical, emotional, sexual abuse is so bad that you need help. Like you can't do this on your own. But just in general, learning how to tolerate that feeling and being able to stay with it. And then you learn, hey, I don't like this feeling, but I can handle it and I don't have to compulsively add thoughts to it. Because as soon as you add thoughts to it, you get into what I call, and as you said before, the alarm anxiety cycle. So the alarm's there. My response is to worry, which of course makes the alarm worse because I believe the worries, which takes me deeper and deeper into my emotional brain. I move farther and farther away from my rational brain, which is kind of like when people say, why was I so worried about that yesterday? Like it really doesn't seem, because your body was completely in alarm. And when your body's in alarm, you lose the rational prefrontal cortex, the rational part of your brain that would actually help you. So not only when you're alarmed in your body do you make more worries, but you lose the part of your brain that's rational gets shut off. So you believe the worries more. So it's just this cycle. Unfortunately, the way we're wired as human beings is that we are wired that the anxiety gets worse. So it's learning, the bottom line is learning how to find the alarm in your body first and being able to stay with that alarm. Sometimes we need a therapist, sometimes we need someone to help us with that. But learning how to stay with that alarm so you don't compulsively have to add thoughts to it. Because as soon as you start adding thoughts to it, that's when it snowballs. That's when it gets out of control. And you're bypassing it too. You're not actually doing anything for the root cause. As soon as you escape up into your head, you've lost the root cause that's maybe in your belly. And you're not even there anymore. And if you're not with it, you can't change it. So that's kind of a long-winded way of just saying that, allow yourself to feel the alarm, but don't allow yourself to compulsively add thoughts to it because it's just going to make it worse.
Yeah. And that's a beautiful answer. So you're telling me that as we grow our capacity to stay with the discomfort, then we'll have more choice and we can choose different response and we can find the source of it in our body rather than kind of like ruminating in our minds with more thoughts that come and make it worse.
Which is why CBT, talk therapy, I have nothing against cognitive therapies. I think they will help you cope. I don't think they'll help you heal, but they'll help you cope. But in a way, you're just creating more of the problem, because if you don't actually find that younger version of you, if you don't actually find the alarm and stay with it, all the thinking in the world isn't going to do anything but make you worse.
Yes. And would that be something that you call bottom-up approach, starting from the body?
Yeah.
Yeah.
And I think we need both. We definitely need the cognitive structures around it. But I think what current therapy does is it believes that, okay, we'll change the cognitive strategies first, and that will change the body. And it doesn't. We're trying to use conscious strategies to change the unconscious mind, which is essentially the body. And really what we need to do is we need to change the body, which will change the unconscious mind. So that's why most therapies for anxiety don't work, is because they're attacking the wrong problem. They're not actually going at the root cause. And the analogy that I draw is like you're in a little rowboat, it's got a hole in it, and it's filling up with water, and you can bail water out, so the water is kind of like the stress, the anxiety, the worries. You can bail water out, but you're always going to be bailing water out. So what you have to do is go underneath and patch that hole in the hull of the boat, which is basically finding the alarm and dealing with the alarm directly. When you do that, you actually affect the root cause of the problem, rather than just bailing water by trying to think differently.
Yes, I couldn't agree with you more on that. It's all like we talked earlier, it's all stored in the body, felt in the body, and then it needs to be dealt in the body too. You can't just think your way out of
a feeling. And that's one of my favorite quotes is, you can't think your way out of a feeling problem.
Yes, it's a feeling problem. It's not.
It is a feeling problem.
That's
yes,
what
it is. Anxiety, depression, eating disorders, OCD. These are feeling problems. And I think in this society, we believe that we can fix them by thinking. And clearly we can't.
Yeah, because it lives in the body. How can we get out of it? Through the mind.
Totally.
So then some of the claims that are out there, if you do this and that, if you do that and this, work out, eat well, do your thing, that's going to heal your anxiety or get rid of anxiety. Can you talk about some of the false claims that are out there? What are the things?
Yeah, I think a lot of it is, that diet and exercise are going to heal your anxiety. They will help, and if you have very minor anxiety, if you have very low grade anxiety, maybe diet and exercise is all you need. But the people that I deal with have anxiety. It's a daily feature. It's a daily function of their lives, and it affects their lives in a negative way. So diet and exercise is going to help, but it's a big lie in the health field that diet and exercise are going to heal your anxiety. Because unless you actually go in and find that child in you that's still hurting, that posterior cingulate cortex is still rattling off those negative views of yourself, you're not going to heal it. You're going to learn how to cope with it. And this is what I see with like science-based therapy, evidence-based therapy. We're mind, body, and spirit. So mind and body, you can reduce those on some level into sort of scientific reducible parts. But the spirit part is so much a part of healing. And medicine, science hasn't found a way to reduce that yet and use it as a way of healing. So whenever I see evidence-based therapy, I just think coping strategy. It'll help you cope, but it's not going to help you heal unless you actually find the spirit in where you're hurting and fix that. All the scientific things, all the diet, all the supplements, all those things are just going to help you cope. They're not going to help you heal.
Yeah. I really appreciate the way that you bring in the three-dimensional or multi-dimensional aspect of our being as humans. So in the context, I know in the book, in your first book, The Anxiety RX, the red one.
Right. Yeah, sure.
Yeah. And in the red one, you talk about the psychedelic experiences that you had with LSD and ayahuasca. So I'm curious, as a psychedelic therapist myself, how do psychedelics can help with bringing these multi layers and multi aspects of a human being into one, and how can they? I mean, they're not it's not a cure to anything, but how could they facilitate anxiety?
Yeah. So it's really interesting when you put somebody into a functional MRI scanner who's under the influence of a psychedelic. It really paralyzes this default mode network that I was telling you about. So it paralyzes that inner critic. So you get to kind of see and feel on some level who you really are without all this mental chatter, this negative chatter. Because what the psychedelics do is they blur the boundary between the conscious and the unconscious, and they blur the boundary between self and other. So we feel one with everything. We feel one with the trees. We feel one with everything, right? So it's one of those things where I think the psychedelics give us a break from ourselves. They give us a break from this endless chatter that we live with, and then we can actually see another way. We can see a different way of looking at things. And then once you've seen it, once you've been to the land of, over the hill and you've seen the other side, it's very hard to go back. People do it because it's so automatic, like the way that they've built their bodily structures and that kind of thing. I'm not talking about kidneys, liver. I'm talking about the sort of the mental programs that are kind of stuck in our bodies. Those tend to come back as soon as the psychedelic wears off. But when we see a different way and we feel a different way, we can start accessing the unconscious, because these programs are in the unconscious. And what I was saying before is it's very difficult to use the conscious mind to change these unconscious body-based programs. So that's what most traditional therapies believe, is that if we just understand it, we understand the root of it consciously, rationally, that it's going to heal. And it doesn't. And in fact, we're just kind of dangling people over the gates of hell, showing them a therapy that's supposed to heal them that doesn't. So that's why people get so frustrated with therapy, and they think, oh, I must be the problem. I must be the problem because I've gone through 20 years of therapy and I'm not any better. It's like, no, you're not the problem. It's just that therapy is flawed. The premise of therapy, that we can use the conscious mind to change these unconscious programming, this unconscious programming is flawed. It doesn't work that way. So when we get into the psychedelics, we start actually actively accessing the unconscious. And sometimes that can be terrifying, like it was with me. And sometimes it can be quite beautiful for people. So I've had lots of people, maybe not lots, I've had a few people who have gone and done the ayahuasca experience and have no desire for drugs or alcohol after that. So it, even people who are heavy drinkers. So it does change us at an unconscious level, at a body-based level. So I think it's very helpful. The issue sometimes is that people can really get re-traumatized by the psychedelics. They're not always helpful. And I think there is this feeling among society is like, well, I'm not going to go for therapy. I'm just going to go to Peru for a weekend and do this, and I'm going to be healed when I come back. And I think there's a real danger in that sort of short circuit, because if you look at the way the brain wires, and if you look at the way that memories are wired, they're wired over time. So if I said to you, I'm going to show you how to unlearn how to ride a bike, that's not going to happen very quickly. It is one of those things that it's wired into us in a certain way. And when to rewire something, it takes time. And that's why I have some issues with these rapid transformation therapies and all that kind of thing, is because they're saying, oh, it's not how neurology works. It's not how nerve cells work. It's not how they regenerate, degenerate, whatever it is. It doesn't work quickly. It has to be supported by your thoughts and feelings as well. And it has to be consistent. And when you're consistent over time, like I said, when you're consistent over time in allowing yourself to feel this alarm in your body, and even though you don't like it, you stick with it longer and longer and longer and longer. It's kind of like learning how to hold your breath. It's uncomfortable, but you learn this tolerance over the course of time. And it takes a while, but once you get to that point, you start building some resilience and capacity in your entire system, so that when you get triggered, when you have a fight with your partner or something, you get a huge tax bill or something, you don't automatically just spin out of control like you used to. You're like, okay, where do I feel this in my body? This is my alarm. It's my protective system. It's not trying to hurt me. It's basically just trying to warn me. So can I stay with it and compassionately say, hey, I know you're trying to warn me, and I appreciate that. I'm going to stay with you, because you're basically talking to your younger self, right? I'm going to stay with you. You're not going to go through what you went through when you were 8 years old and your mother was screaming at you when she was drunk. You're not going to go there again. You never have to go back there again. I'm with you. I'm here for you. I love you. I have this acronym I call SHOULD. And this is what we should have got when we were younger. So it's see, hear, open to, understand, love, and defend. That's what we should have got when we were younger. Now we can give that to this younger version of ourselves, this alarmed version of ourselves today. And over the course of time, then we can start learning how to heal. But it doesn't happen quickly. And that's one of my frustrations about when I see things about, cure your anxiety in 7 days. This is how I did it. It just doesn't work. It just doesn't work.
Yeah. No. like you said, it's happening in the nervous system level, at the body level. It cannot just be gone overnight. It didn't happen overnight for it to be gone overnight. So that's just, yeah. So that brings me to your book, because I really loved reading your book, even though it was a big one.
It's a long one. Yeah, for sure. Yeah.
And I understand why it is, because
the red one. Yeah.
Yes, thank you. That one.
Do you have the blue one?
I don't have the blue one yet.
Okay, I should send you a copy of it. Send me your address and I'll send you a copy of it.
So the red one, I really loved reading it because you have this beautiful sense of humor that has always been with you ever since I met you.
And I was a stand-up comic for 10 years. So I toured through Canada with Yuck Yuck. So yeah, I hope I have a sense of humor being up there.
So then that makes this difficult topic so easy to understand, with so much information that you put in the book. How is your second book different than your first book?
Great question. Love that. I think because I've been on 250 podcasts in the last 4 years since the first book came out, the theories and the premises are all exactly the same. It's just I can explain it so much more clearly now. Like even today when I'm talking to you, it's like I'm so much more clear. Like if I listen to my podcast from 3 years ago, I'm kind of rambly. The same information is there, but now I'm just really concise. Like here's the alarm. This is where you feel it. You got to stay with it. And you got to stop yourself from compulsively going into your thinking. So the new one has something called the Anxiety Toolkit in it, which is about 7 things that I've found over the years, over 100,000 patient encounters. These are kind of like the 7 best tips that I've ever given people for anxiety. Like one of them is, am I safe in this moment? Which is basically you wake up in the middle of the night, you're completely freaked out, but you just kind of go, put your hand on your chest and you kind of go, yeah, I'm worried about this, this, and this. But that's all in the future. In the moment right now, I'm lying warm, safe, comfortable in my bed, and I can stay with that. I am safe in this moment. And if you're safe in this moment, you're safe because the moment is all you ever have. So there's like 7, some of them are like breathing things and that kind of thing. But these are the 7 things that I've found that have been most helpful for my anxiety patients. Now, again, I'm teaching you little things that help you cope, but not help you heal. So the rest of the book is about how you connect with yourself. So I would say that the second book is about 33%. It's about a third different than the first. So there's less personal stories in the second one. It's more practical. It's more, it's more about your anxiety than my anxiety, even though the stories are kind of fun. But it's really about how you understand your own self. And it's very comprehensive, as you say. There's a lot of stuff in there. And I had somebody send me something the other day. It's like, I call this my anxiety Bible, because there's so many things in there. Now, the other program that I have is called Your Mind Body Prescription for Permanent Anxiety Healing, which is an online program, which is about 2.5 hours. It's considerably shorter in information than the book. The book is, it covers everything: inability to receive, the ego dragon, this part of us that got incarnated when we were very young, that is really intense and powerful, but not that smart, the ego dragon. So it prevents you from doing anything that ever hurt you in the past. So the second book is really about, it's much more practical. It's much more concise. I think it's easier to understand than the first book. And I think it's just better written, because I was never really a writer. I was more of a doctor. Now, over the course of 4 years, I've learned a lot more about my own theories and how to explain them in a more concise manner. And I think that's what the second book offers. It gives you the same information, but in a shorter, more directed format. But the humor is still there, which is great.
That's amazing. You're just being humble. The first book was not difficult to read, at least in my experience. It was pretty easy to read. With that much information, because it's a lot of information. And I do have it in my book recommendation list, and I do refer my clients to read that, because I think it's tremendous. If you understand the concept that you're on, it just makes everything so much easier to deal with. And I'm very much looking forward to your second book. Whether you send it to me or not, I'll just I'll just buy it, because everybody always asking for tools. Oh, what should I do? What should I do now? Okay, now I understand where this comes from. What do I do? Especially about panic attacks. I remember back in the old days, you were saying if somebody asks you in the group, oh, my panic attack came, or the panic attack came, what should I do? And I still use this again. There's a lot that I use from what I learned from you. Welcome it. Welcome the panic attack. Because if you resist it, it just gets worse. So
easier said than done, of course. Easier said than done. Now, I'll come back to panic attacks in a minute. I did want to say one more thing about the book now that I remember. A lot of people on the, well, not a lot, but a few people on the Amazon reviews will say it's repetitive. Like, it's repetitive. And it's like, I want to yell and say, yeah, I wrote it that way. I can change your conscious mind very, very quickly. But what I'm trying to do with this book is create an experience for you so that when you finish this book, you will have a different feeling sense in your body of what anxiety is and what you can do about it. I can tell you that anxiety is in your body once or twice, and you can go, oh yeah, that makes sense. But if I tell it to you 25 times, by the end of that book, you're never going to go back to the same attitude about anxiety again. That's why I call the book an experience. It's not just reading it. It's actually feeling it. It's actually changing the way you perceive your own anxiety, which most books don't do that. They give you information, which I do, but I do repeat it. And I do use different stories, but I say the same thing over and over. And it's repetitive for a reason. It's repetitive because I want to change your unconscious mind. And we do that with repetition. We can't change your unconscious mind unless we beat you over the head with it, because it just doesn't work that way. So, and now getting back to panic attacks. Yeah. The thing about panic attacks is the more you resist them, the more you're sort of just delaying the inevitable, onslaught of the wave. So if you're on a beach and there's like slow little waves coming in, and for some reason you can stop those waves, but they're going to build up. And they're going to build up and build up and build up to the point where you can't stop them anymore. That's kind of what panic attack is. So if you can start, when you start feeling that prodrome, like everybody knows what it's like when they're about to get a panic attack. Like they know it really, really well. So that's why I say, can you welcome those sensations early while the waves are relatively small? It's still uncomfortable and it's still really hard to do, is bring that panic attack in. But if you do it that way, it never really gets to that huge, huge, huge point that it just crushes you, right? Because a lot of what panic attacks are is resistance to panic attacks. That's what causes so much of the pain. So if you learn and you teach yourself not to resist them, yeah, it's still going to be uncomfortable. Just like the alarm in your system is uncomfortable. But if you allow it to be there, it won't crescendo on you, which is what causes most of the pain. So ironically, it's allowing it, it's welcoming it in, allows it to hit you in a very controlled environment, as opposed to resisting it, in which case it just overwhelms you.
Beautiful. Thank you. I could ask you a million more questions, but I'm cognizant of time, and I really, really, really appreciate you sharing your wisdom, sharing your knowledge. And I'm so, so grateful that I know you personally and I have worked with you. So thank you. Thank you very much for today.
You're welcome, Sadaf.
So before I wrap it up, can you tell the people that are going to listen to this, how can they find you? Of course, you have your own podcast. There's your Instagram platform, the 2 great books that I will put the reference in, and the course that you just mentioned. How is that all?
It's all under one thing. It's all under the Anxiety MD, not the Anxiety Doctor, the Anxiety MD. And it's my website, it's my Instagram, and if you just type into Google the Anxiety MD, all one word, I'm all over there. You won't have a problem finding me.
Perfect. That's amazing. Well, thank you very much. And yeah, I will see you later.
Anytime, Sadaf. Thanks for having me.
Thank you.